Mentally challenged. Challenged or developmentally disabled is a good alternative to mentally retarded. Mentally challenged is a most preferred word and it covers conditions like Down syndrome, autism, cerebral palsy, uncontrolled epilepsy, aphasia, and other conditions that affect mental functioning in different ways. Mentally challenged or mental retardation is a developmental disability characterized by deficits in general intellectual and adaptive functioning. It refers to someone with an IQ at or below 70 causing problems with everyday general living. People who are mentally retarded may have problems with communication, taking care of themselves, daily living, social skills, school and work. The condition, which is more common in boys than girls, symptoms may appear at birth or later in childhood. In most cases, it persists throughout adulthood. In general, mentally retarded children reach developmental milestones such as walking and talking much later than the general population. Someone who has an intellectual disability will have trouble learning and functioning in everyday life, but having an intellectual disability doesn't mean a person can't learn. In intellectual disability, he or she can learn new skills, but he or she might learn them comparatively slower than other kids. Some kids with autism, Down syndrome, or cerebral palsy may be described as having an intellectual disability. Yet they often have a great capacity to learn and become quite capable kids. Earlier, intellectual disabilities were called mental retardation, but that term was later changed into mentally challenged as the term mental retardation would hurt one's feelings. Mentally challenged is now considered the polite way of referring to someone who has a mental or intellectual disability. There are varying degrees of intellectual disability from mild to profound. Severe cases of intellectual disability are diagnosed at birth. Almost all cases of intellectual disabilities are diagnosed by the time a child reaches 18 years of age. A child is considered intellectually disabled if he or she has limitations in both IQ and adaptive behaviors. If only one or the other is present, the child is not considered intellectually disabled. Intellectual disability is thought to affect about 1% of the population. Of those affected, 85% have mild intellectual disability. This means they are just a little slower than average to learn new information or skills. With the right support, most will be able to live independently as adults. Causes of mental retardation. In about 35% of cases, the cause of mental retardation cannot be found. Biological and environmental factors that can cause mental retardation include genetics, metabolic disorders, prenatal issues, childhood illnesses, and injuries. The most common causes of intellectual disability are fetal alcohol syndrome, brain damage caused by the use of prescription or illegal drugs during pregnancy, brain injury and disease, genetic conditions such as Down syndrome, neurofibromatosis, congenital hypothyroidism, galactosemia and phenylketonuria. Problems during pregnancy. Intellectual disability can result when the fetus does not develop properly or something interfere with fetal brain development. Includes exposure to alcohol or drug use, cigarette smoking, malnutrition, maternal infections, high BP or preeclampsia. Trauma during childbirth. If a baby has problems during labor and birth such as prematurity or baby is deprived of oxygen, prolonged or difficult birth, he or she may have developmental disability due to brain damage. Extreme malnutrition, exposure to toxic substances such as lead, and severe neglect or abuse can also cause intellectual disability. Birth defects, accumulation of cerebrospinal fluid in the brain or hydrocephalus, early childhood illness such as whooping cough, measles or infections in the brain such as meningitis and encephalitis. There are many different signs of intellectual disability in children. Signs may appear during infancy, or they may not be noticeable until a child reaches school age. The level of impairment often depends on the severity of the disability. Mentally retarded children lag behind their peers in developmental milestones such as smiling, sitting up, walking, and talking. They often demonstrate lower than normal levels of interest in their environment and responsiveness to others, and they are slower than other children in reacting to visual or auditory stimulation. Some of the most common early signs can include delays in reaching milestones later than other children, continued difficulties with speech and language, difficulty with self-care skills, behavioral and social problems, difficulty with remembering things, problem solving or logical thinking, failure to grow intellectually and adjust to new situations, difficulty understanding and following social rules. In children with severe or profound intellectual disability, there may be other health problems as well. These problems may include seizures, mood disorders, vision or hearing problems. Mental retardation varies in severity. There are 4 levels of mental retardation: mild, moderate, severe, and profound, based on child's IQ level and degree of social adjustment. Mild mental retardation. IQ range between 50 to 69. The vast majority of people with mental retardation have IQ levels of 55 to 69 and are considered mildly retarded. Mildly retarded children often go undiagnosed until they are well into their school years. They are often slower to walk, talk, and feed themselves than most other children. They can learn practical skills including reading and math up to 6th grade level. They can become fairly self-sufficient and can live on their own with community and social support. Moderate retardation, IQ range of 35 to 49. Children who are moderately retarded show noticeable delays in developing speech and motor skills. About 10% of the mentally retarded population is considered moderately retarded. People with moderate retardation need considerable supports in school, at home, and in the community in order to fully participate. They can carry out work and self-care tasks with moderate supervision. They can learn basic communication, reading, writing and counting skills, health and safety habits, and other simple skills. They are generally unable to live alone, but they can do some simple tasks and can often get around on their own to familiar places and can take part in various types of social activities. Severe retardation, IQ range of 20 to 35. People with severe mental retardation have IQ scores ranging from 20 to 35. With training, they may learn self-care and communication skills but are unable to independently care for themselves without ongoing significant assistance from a caregiver throughout adulthood. Profound retardation, having an IQ of less than 20. Only 1 to 2% of the mentally retarded population is classified as profoundly retarded. They may be able to develop basic self-care and communication skills with appropriate support and training. Their retardation is often caused by an accompanying neurological disorder. Their condition is usually diagnosed at birth, and they may have other medical problems and need nursing care. These children show delays in all aspects of development and cannot take care of themselves. Hence, they need constant help and supervision. Diagnosis. A diagnosis of mentally challenged is made if an individual has an intellectual functioning level well below average and significant limitations in 2 or more adaptive skill areas. A complete medical, family, social and educational history collection from interviews with parents and caretakers, physical and neurological examination, assessing milestones development and investigations. A variety of tests may be done to confirm the diagnosis. Your child's doctor will consider the test results, interviews with you, and observations of your child, and testing of intelligence and adaptive behaviors. In children with developmental delays, the doctor will perform tests to rule out other problems, including hearing problems and certain neurological disorders. Your child will be given psychological tests to measure their learning abilities and intellectual functioning. Such tests include the Stanford Binet Intelligence Scale, the Wechsler Intelligence Scales, which will help the doctor determine your child's IQ and provides an assessment of your child's daily living skills and social abilities compared to other children in the same age group. Your child's evaluation process might include visits to specialists who may include pediatrician, neurologist, psychologist, speech therapist, and a social worker. Treatment. There is no cure for mental retardation. Treatment of mental retardation depends on the underlying cause. The main goal of treatment is to help your child reach their full potential in terms of education, social skills, and life skills. Treatment may include behavior therapy, occupational therapy, counseling, and in some cases, special diets or medical treatments can help. In all cases, special education starting as early in infancy as possible can help people with mental retardation maximize their abilities. For children with mental retardation, the support of parents, specially trained educators, and the community helps them reach to their fullest ability. Parents may benefit from ongoing counseling to discuss their options and to help them cope with the changes in their household that arise from living with someone who has mental retardation. Your child will probably need ongoing counseling to help them cope with their disability. Mildly retarded individuals can often acquire the skills needed to live independently and hold an outside job. Moderate to profoundly retarded individuals usually require supervised community living. Extracurricular activities and social programs are also important in helping retarded children and adolescents gain self-esteem. Family therapy can help relatives of the mentally retarded develop coping skills. It can also help parents deal with feelings of guilt or anger. Families are likely to need extra help when the child is approaching puberty. Parents should be taught to develop right attitude towards their child and behavior modification techniques to decrease problematic behaviors, increase adaptive behaviors, and develop new skills. Can intellectual disability be prevented? Certain causes of intellectual disability are preventable. The most common of these is fetal alcohol syndrome. Pregnant women should not drink alcohol. Getting proper prenatal care, taking a prenatal vitamin, and getting vaccinated against certain infectious diseases can also lower the risk that your child will be born with intellectual disabilities. In families with a history of genetic disorders, genetic counseling and testing may be recommended to determine the risks of occurrence of chromosomal or genetic disorders before conception. Certain medical tests such as ultrasound and amniocentesis, chorionic villus sampling can help detect inherited metabolic and chromosomal disorders linked to mental retardation. Vaccinations can prevent pregnant women from getting infections such as German measles that can harm developing fetus. Avoiding drugs and alcohol during pregnancy help prevent mental retardation. Screening blood tests for newborns can detect some disorders at birth, allowing for earlier treatment. It is also important to protect babies from lead poisoning and head injuries. Although these tests may identify problems before birth, they cannot correct them. Improved health care, prenatal testing, and public health education are making it possible to avoid some cases of mental retardation. Mental retardation is a condition which cannot be cured. Mentally retarded persons are not mentally ill. They are just slow in their mental development. Therefore, when their actual age increases with time, the mental development does not occur at the same pace to catch up with the actual age. They can be taught many things, but they need to be trained systematically. They can perform many jobs and activities under supervision. Parents must be told that whatever may be the cause, training the child will improve his condition. The earlier the training is started, the better the chances of improvement. Thank you.